Hello everyone, I'm Nermina Voloder. In this episode, we will explore the impact of COVID-19 on female leadership, equality, and women's rights. As a journalist, feminist, and activist, I'm looking to elevate the role of female leaders globally as a transformative driving force in this crisis. Let's meet our speakers. Thank you very much for joining me. So let's set the global picture. What challenges can be identified for women and girls in the pandemic? And why is it important to address this question? Why we are talking about women specifically in pandemic? Maybe, Salome, we can start with you.
Thank you, Nermina. Thank you for this very interesting conversation starting in the time of crisis. And it's not only the crisis for women, but also for everyone. It's a strange times, and obviously talking about the marginalized groups, about the groups who have different needs. And unfortunately, we're still talking about women as a marginalized group in worldwide. And obviously, it is very problematic not to talk about women in this timing, because women are exactly the group, the biggest group who is facing the challenges. Will it be the unpaid work? Will it be the pay gap? Will it be informal workplaces that they are facing at this time? And unfortunately, we see that during even before the pandemics happened, women were facing these challenges, and at this time they are having and facing higher barriers. Will it be social, economic, or political spheres? And when we're talking about gender gaps, it's very important to touch a little bit about the data as well, because sometimes we forget how big these gaps are in economy. In the best case scenario, averagely we're talking about 16%, and it goes up to 35%. And when we're talking about the more developing countries like Georgia, the country that I come from, we're talking about the higher numbers, like more closely to 35%. And when we're talking about unpaid care that the women are taking every day, and before the pandemics, but also the pandemic timing showed how much care women are taking at their houses, and domestic care that they are facing at this time. But it's also very important to touch about the informal work places, because for instance in Georgia, many women are working as a nannies or as caregivers, but not officially employed. And at this stage, they are out of any kind of security, any kind of insurance, and also they have no jobs at this moment. So when we're talking about pandemics and when we're talking about women as a target group, it's very important to think about very inclusive policies, how we'll be tackling this issue later on, because what we saw in a very recent challenges, will it be with Ebola crisis, for instance, women were damaged higher, but their losses and their integration was took a longer period. So when we're talking at this stage, I think it's obvious that when women are facing double problems or triple problems rather than other groups, comparing to men, but we have to also talk how we will tackle this issue later on.
Absolutely. And you open a lot of different issues and struggles regarding women's position during this pandemic or in any crisis. So let's discuss, Olivia, right now, how the coronavirus is affecting different communities in the United States. You are a journalist, and it's really important to read through many different media outlets and newsrooms. I heard a lot of discussion why certain demographic groups, including African Americans, are hit particularly hard. And what about local officials, how they are responding to this challenge?
Certainly. I think it's just important in countries all around the world, seeing that essential workers and service workers, often with low incomes, are disproportionately impacted by this coronavirus. And when we say low income in the United States, we're disproportionately talking about communities of color, African-American communities. And we're seeing a devastating impact on our African-American communities here, partially who are having higher rates of infection, but also death as a result of coronavirus. Some of those reasons include just higher health conditions because of lack of access to health insurance. I mean, African-American communities tend to have a really high rate of hypertension, heart disease, diabetes, lung disease. And when we're talking about these kind of pre-existing issues, these are all things that are exacerbated by the respiratory issues that come with the coronavirus. We're also talking about African Americans who hold a lot of essential positions: grocery store workers, delivery workers, transportation. These are industries that are heavily populated by African Americans, Hispanics, Latinos within our country. And we're also talking about lower housing and environmental conditions that come with those poorer housing conditions that are making our minority populations more susceptible to this COVID crisis.
So the coronavirus pandemic may be the largest test for political leadership the world has ever witnessed. And let's say that every leader on the planet is facing the same potential threat. But I've read a really interesting article entitled New Zealand's Prime Minister may be the most effective leader on the planet. And just to make clear, it's she. So how would you, Nermina, evaluate female leadership response and politics in the time of pandemic? You work a lot with leaders, but not just female leaders, but how would you evaluate right now all of their efforts and work?
Yes, thank you, Marina, very much for inviting me to talk about the issues and some of the things that are close to my heart. As you know, the Westminster Foundation for Democracy works with the political parties around the world, and here in Bosnia, we try to improve the political participation of women, especially at the decision-making level. You're absolutely right. There has been some positive coverage about women's political leadership, and when we look at some of the cases of governments led by women, I would have to say it's still too early for some scientific evidence to kind of make these comparisons. But there has been a lot of the praise in the media about how women have responded and handled this crisis situation. I have to say that there are some tendencies and trends that we can already observe now when it comes to different kind of gender perspective and gender approaches, or approaches between men and women leaders. We have seen a different style of leadership as well. So what makes women different, and if we dare to say even better leaders in the crisis situation like this? I think there are several aspects to that. First one is that we have seen a lot of the examples of male political leaders basically undermining and downplaying the risks of the COVID disease. And when we contrast this to women who have been head of their governments, we see a very, very cautious approach. And this has been good for these communities, because this meant also the very decisive actions and responses that actually benefited and sort of countered all of these risks. Also, I think something that we notice in these different leadership styles is that women have been praised basically for their good communication skills, the way how they have sort of channeled these messages in a very clear and concise way, and the way they got the feedback and buy-in from the public. We've seen this from Chancellor Merkel's especially speeches at the beginning of the pandemic. Also, something that it's very interesting, and this can be related to some of the work that we are doing in Bosnia and Herzegovina. And this specific trend in women's political leadership is their reliance on other people. When I say other people, I mean experts. So oftentimes, women suffer from lack of confidence. And on the other hand, men tend to suffer from overconfidence. I think here, a lot of women leaders across the globe have surrounded themselves with experts and have relied on their advices. So in that sense, that has been proven as a good result. But I think the most important thing that these women leaders have contributed to basically this change of narrative. When we think about leaders, we especially in this region, in these countries like this, where there's a still very dominant traditional norms, we think of men as leaders. And these few role models that have been successful in responding to this big challenge have changed this. Now it's an inspiration to younger women who are now maybe less intimidated by politics and managing crisis.
So many women would argue that from that leadership path, somehow unpaid female work put them aside. And especially today when we have a life without common social services. So based on the UN report about women's rights during this pandemic, I'll just read this briefly. Women spend 3 times more on unpaid care and domestic work than men, and women aged 25 to 34 globally are 25% more likely than men to live in extreme poverty. So now we can discuss about facts and figures. Seda, when we talk about female economic indicators, do you believe that the situation is even worse on the field?
Thank you, Marina, first of all, for inviting me to this interesting and important discussion. When we get to unpaid work, women's unpaid work has increased during pandemic. That's a fact. The burden on women has increased as most of them are under pressure due to the high workload they are facing. So even on this call, we all know how difficult it is to work from home, and let aside the thing that you have to perform the household, and then you also have to take care of the children if you have them. So I left my 3 kids with grandparents to get into this call. During the pandemic, in families where the couples both works, some of them suddenly found themselves like in the situation their grandparents were, one homemaker and one breadwinner. They had to choose. So in most cases, women were the ones to quit or stop their jobs for an uncertain period. Now imagine the situations with single moms who face even harder decisions. To me, the conversation of unpaid labor goes around one keyword, which is care. So imagine, what do pandemic patients need? They need care. They need to be taken care of. What do self-isolated people, elder people need? They need care. What do children kept home from schools closed? Again, care. So all this care work is the unpaid job, which falls more heavily on women's shoulders because of the family structures, especially in traditional societies like in Armenia, but also because of the existing structure of the workforce itself. It's not just about social norms, I think, of women performing care roles. It's also about practicalities. We are used that women, the mother, is the one to take care of children, or most of the household. With the schools closed, luckily there are many fathers who step up, but that's unfortunately not a universal thing. And the coronavirus crisis is global and unfortunately long-lasting. So it is also economic and medical. So however, it is also, it offers some kind of opportunities. This could be the first outbreak that gender roles and differences could be recorded and taken into account by researchers, policymakers, so that after the pandemic, it could be a light to not let women's independence be another victim of the pandemic.
Yes, probably we could all agree that women still have to do and achieve more because of social pressure and expectation of others. But Salome, what do you think? How to grapple with traditional gender-based roles in regular time, but especially in time of crisis?
Indeed, I'll just follow the route of Sada, what she was telling, because unfortunately still in 21st century, we're living in a very masculine world, what we've been just discussing with a few speakers before me. And in a very traditional communities like in Georgia, I'll definitely say that the gender roles are so much assigned to the women. And it has been, and we've been talking about the organizations that are working on the political empowerment of women or their integration in social economic lives. We've been talking about the unpaid work, about their labor, about the 3 times, thank you Marina, talking about the data that women are taking through, are doing 3 times more work at home rather than men. And this is a very general data from the global world, but if you compare it to the more traditional and masculine communities like in Georgia, I would say that it's 100% women doing all the domestic work and taking care of their families, because exactly this is the gender-based roles that we are assigned in our communities, and the expectations that who is taking care of family is the woman, and the man has to bring the money here. And if there is the sacrifices to be taken, of course the woman has to do double, triple work rather than a man, because if you are working and if you're a modern woman who wants to work but at the same time have the family, to take care of your family and to somehow to be still in this kind of gender-based role in your community, you have to commit triple, as the data says. And here I want to also link a little bit with the domestic violence here as well, because unfortunately in the traditional communities, women have, and we've been talking about this, because women have a very low income in these traditional and very masculine communities, and it's very much also linked to the economic and social problems in the countries. And like in Georgia now, we're talking that women are facing higher domestic violence threats within their families, because basically they're living with their abusers. And if we're looking at the data, the worldwide data, we say that at least 1 woman out of 3 has faced the violence in their lifetime. And how can we imagine in the quarantine lockdown living with their abusers when there are no social services and in very traditional communities? And that's why I'm also linking it to that, because people and women are somehow afraid to talk about this in a very traditional and masculine communities, because they are very ashamed, and they have this gender-based role as well to be not to talk about this kind of problems and keep it in their families. And it's not, and when we're talking, and I've been hearing so much about that, it's very problematic that women are doing more and triple things at home, but we see that it's also very dangerous for them to stay at homes at these times. And living in these very gender-based roles and keeping ourselves smiling in our masculine communities, I think it's not only a burden for us, but it's also dangerous. And seriously, all the organizations that are working on that have to really open up their minds and be very inclusive in creating exit strategies. And they have to really think on this as well from the beginning, and not from later on, when we really see the higher data of higher increase in violence or increase in other kind of damage in women's lives.
Absolutely. From my standpoint, there is no way to speak about women empowerment without economical independence. So if we are not independent in any sense, it's so hard to find our leadership mission and to do whatever we would like to do as a girls and as a women. So when we talk about domestic violence, it's absolutely a huge problem globally, and number of victims is growing during any crisis. So Olivia, maybe you can provide us with a few information or findings. Do we know what's going on right now regarding a multi-sector approach in domestic violence in the US?
So one thing that we're facing is there's like a lack of, like, one thing, you can't talk about domestic violence exit strategies without talking about resources and relocation locations. And that means shelters, safe houses, financial and economical support and assistance. In some cases, that means police escorts. And we're in a pandemic where social distancing is something a majority of people are practicing. Our shelters are full because, you know, in America, shelters are full because we're trying to find locations for our homeless populations. We're trying to find resources for people who are in extreme risk situations. And so providers who provide relocation assistance and support to these women during this time, they're having to make decisions where they prioritize, in some cases, you know, severity of causes, because there's a lack of relocation availability. And so that's something that we're dealing with here in the United States. But I mean, when you talk about being locked in with an abuser, that's children also being locked in, that's families being locked in. I mean, it takes a lot to build up a support system in order to be able to move. And you do need financial independence, as you mentioned, in order to have the privilege and the power and the empowerment to take control of your situation and decide what your next move is. And it's really hard in this pandemic when everybody is kind of desperate in the situations they're living in.
So we could maybe conclude that globally, somehow female leaders should take the same approach, especially in terms of building a gender inclusive economic response and recovery. Nermina, what measures are needed to build that kind of approach, especially in the world after Corona?
Well, this is something that has been also discussed in pre-Corona times, and I often feel basically that the principles are very much the same. We need to have women's voices. We need to have a bigger number of women at the decision-making levels, at the table where the important decisions are being made. So without the voice of women, without the women representing the experiences of other women, the problems and the challenges they face, most of these policies remain gender blind. We have seen this at the different kind of levels here locally in Bosnia, in the Western Balkan regions, but also throughout the world. We have had governments, local level councils, parliaments with just one woman represented. In that sense, there hasn't been any kind of inclusive policy making. We are now facing some of the worrying trends here locally, where basically the economic recovery and responses to people losing jobs and a lot of these industries being closed during the pandemic means taking away money and budgets from the vulnerable groups. When this happens, when these kind of bad decisions are being made, we need to have a civil society, we need to have a strong women in politics and women in different kind of sectors to raise their voices and actually to draw attention that all of these rights that we probably sometimes take for granted are now put in risk. So I have to say, increasing more women in decision-making process would be the first step. This is especially important with very restricted and limited budgets that some of our poor countries are having. So you have to make these tough decisions where to reallocate. And as I said, the tendency is to actually take it from the most vulnerable groups. And as we saw, women are a part of that category.
Well, maybe we don't have a huge budget or a lot of money to protect ourselves and to promote women's rights, but we have technology, luckily, especially now. So, Sarah, you run one really important initiative or organization, Girls in Tech. And how did technology help us deal with this crisis? And what about women in business? How often you are seeing that startups, businesses are taking advantage of this situation to shift more businesses online?
The idea of turning the crisis into an opportunity is more for technology people and e-commerce businesses. Even if the digital presence and toolkits weren't of much interest to a number of stakeholders before the crisis, now everyone realized how important and in fact how productive are the digital skills and tools. Of course, many businesses still do not have the resources to provide the same amount of services and products as they would in normal times, but it is beneficial to retool their businesses to fit not only the general needs, but also the needs of the community and of the time specifically. Of course, there are some specific cases like gyms, yoga studios, and other businesses, like they tried to shift online. Some of them during the coronavirus quarantine, many fitness instructors were live streaming, hoping that it is a short time period and they would, but still there is this rent issue, and the governments put increasingly strict measures on public gatherings, and still the rent for the businesses is there. So it's not always the same. The cases are so like the businesses can benefit a lot from the online services. But on the other hand, while most countries have gone into lockdown and as many businesses have been forced to close, several industries have been able to keep operations by shifting online and transitioning to remote work. Moreover, some of the businesses scaled up and tapped onto new markets. Like we are now together at the moment using an application, Zoom, which is one that grew so much all over the world during the pandemic. Some really impressive records come from products that brought more efficient approach to online work, especially because we all have to use online only for a specific, for a certain period of time. For example, one of them is a noise cancelling application created here in Armenia by a startup company, which has gained mass attention, especially during pandemic, because it's a noise cancelling application and it helps to like remove the noise when you are working online. And it recorded 700% user growth during pandemic. That's amazing. Another field is education technology, like edutech we call it, which took over as well, because digital education has usually been a controversial topic, saying that parents fearing that it may harm the kids and make them more addicted to their devices. But now edutech is more prioritized and valued in these times.
Great news. I'm so happy to hear that Girls in Tech, you didn't stop. Actually, this crisis maybe even encourage you and help you to do more. And we can't finish this discussion without discovering a little bit about role of social media and citizen journalism during this pandemic. So Olivia, just briefly, would you evaluate what's going on when we talk about digital media, social media? Is that a helpful conversation? Finally, maybe people believe more to journalists, especially someone who try to find a proper source of information to provide relevant news and maybe help people to understand better what's going on.
Right. I think social media has been crucial in telling these stories of people's lives and the struggles and the championships that they've had during this pandemic. I mean, we're seeing untold number of stories. People are not able to visit loved ones. We're finding that social media is being used as a way to connect loved ones in those last minutes so that they can connect with their family members. We're finding stories coming out of hospitals, our nurses using social media diaries to let us into what they're experiencing on the front lines of these pandemic responses. I mean, social media has been critical to really shedding a light on the human side of this pandemic. I mean, it's very easy to, say this is how it's impacting people. These are, the number of cases. This is the number of deaths. This is the number of, people who were able to recover. But through social media, we have been able to put a face to those stories. And I think that's really humanized the situation for a lot of people. And for people who are going through coronavirus directly, I think it's given them a way to share their stories, their last moments, share what the experience is like. And I think that we're learning a lot.
Absolutely. And hopefully we open many potential long-term implications of the global pandemic on women's rights and equality right now, but also in the post-corona world. So thank you very much for your energy, for your thoughts, for your time. And I hope that we send a clear message that all of us across the globe should raise our voice and help girls and women to be heard, be visible, and engaged in political and social developments. Thank you very much.